Welcome everybody. It's officially 2:02, so let's get started. I'm Eric Nestler, Dean for Academic and Scientific Affairs. With us today, we have Dean Dennis Charney, Marta Filizzola, Dean of our Graduate School, Rosalind Wright, Dean for Translational Biomedical Research, Reginald Miller, Dean for Research, Infrastructure and Operations, and Dr. Gopi Patel from Infectious Disease. Dennis is going to start with a message for us, and then I'll come back and give you an update with some slides. Dennis?
Yeah, so, welcome. Part of my message is finally, we think that we're able to begin to open up our research laboratories in a careful, iterative way. Our primary concern is safety. Safety, safety, safety. And as you'll hear from Eric and Dr. Patel, that we've thought very carefully on how to begin reopening our laboratories in a careful way, protecting the safety of our staff, our faculty, everybody involved. And then we'll see over time how things are going, and then hopefully we can gradually increase the capacity of our research going on. I do also want to acknowledge the incredible quality of the research that has gone on during the COVID pandemic in multiple areas where we have kept our laboratories open, including multiple microbiology laboratories, pathology laboratories, our immunology laboratories, and some others, where the research has been spectacular. It's already had an effect on how we treat patients. And I should also highlight the clinical trial groups that have been testing new treatments, and the groups that have been collecting tissue. All of this work has been done with dedication and passion, with courage and bravery. And so I want to acknowledge all the great work that has already happened. And we could also, use those groups as a bit of a guide on how they conducted the research during this period of time. So, welcome. I look forward to the presentations and the gradual reopening of our research laboratories.
Thanks very much, Dennis. I'm going to begin with my slideshow, which will give you an update on where we stand right now. After my presentation, several of the other panelists will give theirs as well. I thought I would start with these data to give you an indication of what we've just been through in New York City. The top graph shows you the number of inpatients throughout the Mount Sinai Health System over time. This is March 20th, when we made a decision to ramp down research. This was data from just this past Monday. The lower graph indicates the number of new COVID-19 patients admitted to Mount Sinai hospitals over the same time period. And I want to emphasize this adds together data from all 8 of Mount Sinai's hospitals. You can see the extremely good news that over the last 10 or so days, the number of new COVID-19 patients being admitted to Mount Sinai hospitals borne out across New York City has come down to a very significant level. And this is very heartening news indeed. I also want to give you an update on how busy you all have been in submitting grants. To this time last year, compared with last year, we have submitted about 6% more grants this year overall. We've received a bit over $5 million in NIH supplements related to COVID-19. And you can see that the number of grant applications going into a number of sources continues to be at quite a high pace, continuing throughout April and into May. So we've all been very, very busy. And that brings us to where we are today. very happy to be able to initiate what we're calling phase 1 of easing restrictions on our laboratory activities. I'll discuss this as it pertains to wet lab research. Roz Wright will then come on and talk about clinical research. Our goal is to bring non-COVID research, the regular areas of research in which we're engaged, to 25% of our normal capacity. I'll say a bit more about that number in just a moment. I want to emphasize that from the beginning, all medical research is considered essential by federal, state, and local regulations. While non-COVID research ramps up, COVID-related research will continue at its present 100% effort. In fact, many would say that our COVID research has been working at more than 100% effort. Our view is that this 25% figure will actually enable most people to get a substantial amount of work underway for those laboratories that choose to use staggered hours and days. More people will be able to get more work done by using more hours during the course of a day. We ask that computational researchers and our administrative and financial staff to remain home, to continue to work from home. However, those individuals who feel they need to return to campus should feel free to do so, but maintain this low occupancy. People across labs, across computational groups, across offices are going to have to collaborate to make sure that we only have 25% of the normal number of people in that location at any given point in time. Another key feature of phase 1 is that this return to campus is voluntary. We don't want anyone to feel pressured or coerced to come back to campus during this phase 1 period. And we want people who feel that they're being pressured or coerced to report that to us. You could use the feedback form, you could report it to human resources, to your chairs or institute directors, or directly to us. People have been sending me emails asking me what 25% occupancy means. It's going to be different depending on what building we're in, what laboratory floor we're in. Not every laboratory is constructed similarly. One rule of thumb might be 1 person per bay, but in other labs where the bays are so long, there could be more than 1 person per bay as long as social distancing is maintained. Another question that people have asked is, what about those instances where people need to be closer together? If a student needs to learn how to do a task, or during a dissection that requires people to be in closer proximity for a limited amount of time, that is okay. We just need to minimize that time. Of course, wear face masks at all time and practice good hygiene. A similar reduction in density should be seen in procedure rooms, tissue culture rooms, microscope rooms, behavior testing rooms, and during lunch and breaks as well. In general, we're not going to walk around with a calculator to figure out if you're at 25% occupancy. Everybody has an idea of what a full lab looks like. Your lab should be no more than 25% of that capacity. Social distancing is one of the most important principles that we need to maintain at all times possible, except when explicitly prevented by required work. Face masks must be worn at all time on campus. And thanks to Reg Miller, we've arranged a system which he'll review with you a bit later, where each laboratory will be able to obtain enough face masks to give each person a clean face mask every day at 1 week at a time, so that this should proceed very, very smoothly. Hygiene and cleaning is another critical ingredient of this. Normal housekeeping activities will resume next Monday, but each of us in our own labs are going to be responsible for maintaining better standards of cleanliness. We want labs, all surfaces of benches and the like, to be cleaned at the start and end of each day, or for those labs who are operating in multiple shifts, really at the start and end of each shift. These principles, social distancing, face masks, hygiene, cleanliness, are going to be key to our safety. I already mentioned hand washing and hygiene. A lot of people have asked about elevators and elevator lobbies. Please use common sense. We'll talk about this a little bit more. We're asking people not to crowd in the elevators and to use good social distancing practices for them as well. Gopi Patel will be speaking more directly about testing that's available, but I wanted to give you an update. Obviously, if you wake up one morning and you're symptomatic, don't come to work. If you're at work and you develop symptoms, go home immediately. And anyone who becomes symptomatic needs to inform their PI and either employee health services or student health and schedule a test for a virus. Anyone who's symptomatic will get a test for the virus. Anyone who's symptomatic should self-isolate for 10 days. I put an asterisk there because these are rapidly changing guidelines and subject to change further. Anyone who is exposed to someone who is symptomatic should simply monitor themselves closely for symptoms. And Gopi will tell us more about what that entails. And this is important because many of you have asked about this. All employees and trainees at Mount Sinai will be able to get tested for anti-COVID-19 antibodies. Let me repeat that. All employees and trainees will be able to get tested for anti-COVID-19 antibodies. That's about 40,000 people who need testing. This will not happen in a few days. It's going to happen in many weeks. We hope that by the middle of July, we'll be able to get through most of this testing, which we will do in a phased manner. Those folks who have been working on the front lines in the clinic will get testing at the highest priority. People like me who sit in my office most of the day or who go into a non-COVID lab will be a lower priority. We ask people to cooperate with us, but everyone who wants to get that test will get it. Until further notice, all group meetings will be done by Zoom. This has to include all work in progress meetings, classrooms, research seminars, and anything related to thesis exams, proposals, committee meetings, defenses, and so on. We are continuing our efforts to recruit faculty to Mount Sinai. For the time being, for phase 1, these activities also need to be done by Zoom. Many of you have asked about summer interns. Unfortunately, I think it's likely that we are going to have to cancel on-campus summer interns. As we ramp up labs and we're so concerned about the density of humans in our labs, it seems unwise to add interns to the mix. The exceptions might be the rare summer intern who could work remotely on a computational project, and more will be given to you over the next few weeks about that possibility. I want to emphasize that we all have shared responsibility. Ultimately, it's the PI and home departments and institute chairs and directors who will be responsible for these guidelines. Each department and institute has a designated safety officer. We are asking them to inspect every lab every day. Environmental health and safety will also be conducting their own spot checks. Both of these groups will report labs that are in violation to Dr. Charney and to me. And we are going to take those reports extremely seriously. Labs will be shut down if they're non-compliant. We will not have 3 strikes. We're going to be operating on a system of even 1 or 2 strikes. So if you do think you need to have an exception to the guidelines I've outlined, please contact me directly beforehand. The buzzword, the key word, is citizenship. The way that this works well, the way that we get our work done, and the way that we remain safe is by exercising good citizenship. That's defined as the character of an individual viewed as a member of society. Each of our behavior in terms of duties, obligations, and functions. We're counting on all of us to be good citizens. That brings up, what about phase two? We can't say yet when we will go to phase two, when we further ease restrictions on our laboratory. That depends on how things go in phase one. We are going to be monitoring the health of our employees and trainees extremely closely. Without knowing the individual's names, we will monitor whether the source of infection is coming from a particular department or a particular institute or floor at the institution, and we will be closely taking that into consideration. We are extremely heartened by this second point, and I want to emphasize this. Our experience over the past 2 months is that our healthcare workers and our researchers who've been doing COVID-related work have shown no evidence of increased risk for infection. In fact, they have displayed lower rates of infection compared to the general public. Let me repeat that, please. Over the past 2 months, people have been working every day at Mount Sinai in the clinic or in COVID labs, have had lower rates of infection than the rest of New York City. This is why we believe that phase one is safe for us to embark upon at this present time, and we will move to phase two in concert with all of you over the next several weeks. I emphasize that phase one, doing work on campus, is voluntary, but at some point, everyone who needs to be on campus to get their work done effectively must return to campus. And so we'll be having that discussion with you on how we can execute the creation of phase two. With that, I want to call your attention to several resources that we have online. I'll be sharing these by email, so you don't have to write them down. I'm now going to turn things over to Reg Miller to offer a few more specifics about what will be like to resume partial wet lab operations. Roz Wright will then provide a timetable for ramping up clinical research, including clinical trials. Gopi Patel will tell us more about testing and a regime of surveillance and contact tracing that we hope to institute. And Marta Filazzola will talk to us about some graduate school perspectives. So with that, I'm going to stop sharing and allow Reg to start sharing his screen. Reg, take it away.
Okay, Eric, thank you. So as has been stated here, we want to make sure that everyone feels comfortable and ensure that you're returning to a safe work environment. And so as a result, we have prepared some guidance information for you, for those of you who have been off campus and returning back to work. There are two primary sites for information that I want to make sure you're aware of. The first is for general information. That's at the Mount Sinai.org site about COVID. There's a plethora of information there. But we also have a site for research-specific information. In some instances, it's a reposting of information that's on the general site. And in some areas, there's things that we developed specifically. So for instance, for those labs that have been inactive, Environmental Health and Safety has developed a laboratory checklist so you can go on site and look to see the things that you should be thinking about as you're coming into a lab that's been inactive for some period of time. We also have biosafety guidelines for conducting COVID research. There have been questions about just what does it mean to have a BSL-2 enhanced environment. In general, those enhancements require that you use a biosafety cabinet. When you can't, you have increased PPE requirements. The vast majority of research done with COVID samples, patient samples, can be done at BSL-2 enhanced. There are some that require BSL-3 containment, but again, the vast majority can be done at BSL-2 enhancement. Also want to emphasize that just because someone is doing COVID-related research does not necessarily mean that they're using infectious agents. There are computational studies, for instance, and other types of research that are COVID-related, but may not involve infectious diseases. As mentioned, one of the things that we are very concerned about is making sure that you have adequate PPE protective equipment when you return to the labs. So we set up a program, and the details of the PPE distribution program are again available at the Research Roadmap site. Just as a highlight of the program, the primary contacts for the PPE distribution will be the DSOs, your departmental designated safety officers. They will arrange orders and distribution of the labs, working closely with the LSOs, the lab safety officers. And this is a part of their safety responsibility. The program will start primarily focused on making sure you have surgical masks as a face covering. And the metric we're using is 1 mask per person per day, or 5 masks per person per week. Questions about the cost of the program? The program is free. And that's because we're using donated supplies. So that's going to be a cost saving to the labs. Now, of course, as those donated supplies are exhausted, we will have to switch over to a fee for service supplies. It's going to be quite a while before that happens. We created a specific email to request PPE as well as to ask questions at the research PPE requests at mssm.edu. And there will be 3 distribution sites that will be open on Monday. The sites will be the Annenberg building, the Icon building, and Hess for folks to pick up PPE. And Anthony Smalls will be the primary contact for that. As time goes on, we're well aware that there may be other PPE that you may need access to, and the program will be able to provide you with gloves, face shields, and gowns. I do want to emphasize that we will not distribute N95s through this program. Because N95s are still relatively hard to get and in demand on the clinical side of the house, N95s will only be available through stat stores, and you will need to provide proof of fit testing to get N95s. But if you need other PPE going forward, just let us know, and we will check with stat stores and to make that available for you. Also want to emphasize that the cores and shared research resources have remained open throughout this period. Going forward, all the cores had developed plans to increase social distancing. This is going to be through the scheduling program. We're going to reduce the number of people actually working in the cores in order to achieve social distancing. The cores have developed sanitation programs so they can disinfect equipment between users. And some of the cores, where feasible, will actually process samples to eliminate the need for people to actually work in the core. CCMS has developed plans for animal ordering and room use. An email came out about that yesterday, and additional information on that is on the CCMS website, where you can contact the office directly. So in closing, we've talked a lot about the DSOs, and I just want to acknowledge this group of individuals. These are folks who are appointed by the chairs or institute directors. They've taken on both the local and institutional role. They work closely with the laboratory safety officers. And this group has been meeting for quite a while with a focus on developing a culture of safety. This is not something that's new to COVID. It's something the group is very serious about. And if you have an interest in finding out who your DSO is, if you're not aware, the list of DSOs are also available on the Research Roadmap site under the Environment, Health, and Safety tab. And finally, I want to acknowledge the PPE working group. This is a bunch of individuals who got together to actually work out the details of this plan for you all. Chris Canastracci from the Hassel-Plattner Institute, Fanny Tang, the Genetics and Genomic Sciences, Sandy Hattem, Patish, Precision Immunology Institute, Chin Wang from Microbiology, Bill Jensen, Neuroscience, Joseph Einhold from Environment, Health, and Safety, Corey Richardson, who's on a special assignment for the Dean's Office, but also works in CCMS, Anthony Smalls from the Dean's Office. And I really want to give a special thanks to Corrigan Morale, who is the Director of Materials Management for the Mount Sinai Hospital, and Carlos Maceda, who is the Director of Supply Chain. It's another example, you heard of this, the great working relationship between the hospital and the school that's developed as a result during this COVID period. And the working relationship with these two individuals have been excellent. And they've been really key to helping us put this PPE program together. And I will stop sharing here.
Very good, Reg. Thank you very much. And let's turn next to Roz Wright, who will review our timeline to reinitiate clinical research, including clinical trials. Roz, you can start sharing your screen.
Okay, can you see that and hear me?
Yes.
Okay, great. So we wanted to talk also about relaxing restrictions so we can, in the first phase, resume clinical research, including non-COVID studies. Because as both Dennis and Eric have alluded to, we never stopped doing clinical research. Indeed, we've expanded clinical research. And this slide just reminds you of something we talked about on the last town hall and through blast emails around standing up a COVID-19 clinical trials development platform. We've constituted a number of expert subcommittees to review a number of interventional trial proposals that have come through Mount Sinai, and that's across a broad range of therapeutics, as you can see on this slide. I don't expect you to get through this slide. I just wanted to show what we have been doing. We have reviewed, this committee has reviewed 41 trial applications. They've approved 14 and stood up 7 active clinical trials that have either are ongoing and or have already completed enrollment, and we have others in the pipeline to go. And I want to thank Benjamin Chen, who chairs the oversight committee for this, along with Steve Friedman and Ben for making this beautiful slide and keeping us all on track for what we're doing. The research roadmap has been mentioned a couple of times here, and you've been referred back to the site. You'll recall also it's very difficult sometimes to have up-to-date messaging across a health system as large as ours. So I remind you that we have set up a stop on the roadmap specifically so you can get your questions answered rapidly and find the resources around what's being done in clinical research. Also on this slide, it shows that we were so successful with promoting to all of the research community to please be thinking innovatively about research around COVID. And not only the interventional therapeutic trials, we realize now we had to set up similar platform review committees for observational, retrospective, registry, and other types of research. So it's very broad. And really, this was not set up to slow you down. It really was set up out of necessity to ensure that we can provide resources to accommodate as many meritorious studies as possible and minimize redundancies and competition for those resources and patients. And that's really what it was meant for. And really, not to say yours not to go forward with this, but to encourage us all to be collaborative and do team science around here. And it's really been encouraging to see the collaboration and collegiality that's come out of this. And again, it's both the hospital side and the school side, and that's really tremendous to see those collaborations continue to grow. This is just another email to remind you of the email address. You can also send your questions to around research. I mentioned that we had reviewed 41 clinical trials, but you can see that we had many, many more of the non-interventional studies come through, and of 184 applications, we've been able to complete review on 169 and get these moving forward. So thank you all for your innovation and engagement around COVID research. Now we need to keep this going at the same time that we also recognize the need to get back to the critical clinical research we are already doing here at Mount Sinai, and there are many people out there with other chronic diseases that require these clinical trials to continue to go on. We appreciate that, and we wanted to provide a timeline and guiding principles for how we think we can reopen and relax some of the restrictions around. Now we're talking about doing in-person encounters for the clinical research. Many of you have been innovative in other ways to move your research follow-up remotely. Just as in the clinical setting, people have really ramped up telehealth. You have all been very innovative about how can we continue to conduct research and monitor people remotely when possible. That's the safest, no doubt. But as effective May 18th, and we're gonna monitor it just as we talked about for the wet labs, we would like to start to relax restrictions on bringing patients back in for essential clinical trials for face-to-face encounters. The guiding principle, safe research staff is the over sure, just as we've talked about in these other categories. And balancing maximal compliance with the protocol with need to minimize exposure of trial participants and staff to coronavirus. You know, traveling in, just needing to take public transportation many times in New York City is a requirement. So we have to be thoughtful about that. How do we minimize it? Research always involves shared decision on risk and benefit, and now we have added considerations that we need to be talking to our research participants about. Understanding COVID risk as well as traditional risk, given underlying comorbidities, how vulnerable patients are to contracting the coronavirus infection and to have a more severe course if infected. Risk of exposure given travel to and from the clinical site. These are all things you're going to be weighing, certainly, and you already have, to decide when you think it's safe to bring your patients back and how, when that balance tips to the need to come in for their study drug or what have you. It raises new feasibility issues for sure. How comfortable will patients feel to be traveling to and from the clinical site? And that comes to compliance. So in-person visits, we will be relaxing and allowing those to resume in phases. Effective May 18th, we want to resume what you think is essential clinical trials. I give an example here, but there's such a broad variety of how you're going to weigh these things. Ongoing intervention studies requiring study drug where that risk-benefit decision supports such. Cancer trials, etc. Now, we also started to think, how do we best maintain the safety of both the patients that are coming in, our research staff, but others that they're going to encounter when they're here traveling through our health system. We decided that the best way to think about that was to really parallel what we're thinking and how we're thinking about it with the thoughtful guidelines that have been put together for reopening the ambulatory practices. And one of the things that entails is the need for pre-visit screening. And there are certain sites across our health system that have been established where that's going to be happening for ambulatory encounters, but we're going to make use of that for these research encounters as well. When you think you need to bring a study patient in for an in-person visit, they will need to have a pre-screening visit at 5 East 98th Street, Hess, or the CAM site where that's ongoing. And I'm going to refer you to the guidelines for return to practice to be looking at those. And if you hover over this site, you get the link and you can get right directly to it. But I want to also specifically highlight a couple of things that we've pulled out that you need to be thinking about. The process for pre-visit screening on the day of visit registration on page 10 of this, 2 of the things you need to be thinking about. Proactively reach out to study subjects, patients 24 hours prior to their scheduled appointment to screen for COVID symptoms. You want to do that because you don't want to have them travel all the way in, get to their pre-visit screening before they even get into the institution and find out that they have COVID symptoms. So doing that, and then also providing them guidance to arrive 20 minutes prior to the scheduled visit will be helpful to you, because there may be a line. We're going to have to maintain social distancing at those pre-screening visit sites, right? And so there may be a wait when they get there, depending on how many have come before them. And we're also going to comply with the health system's visitor policy rules, right? Only patients for whom a support person has been deemed medically essential or otherwise will be allowed one healthy visitor. What does that mean? Suppose you're doing an Alzheimer's study and it's a dementia patient and they need to have somebody escort them for obvious reasons, or if it's a parent escorting a child for a clinical trial visit. And you can see the site here for expanded discussion of that policy. This also, other feasibility issues you need to consider for in-person visits. Do you require support from other clinical services such as radiology, endoscopy, et cetera, for why you need to bring them in? It is the responsibility of the study team to coordinate with the relevant ambulatory practice that they are able to take that patient on the day they're coming in, they're able to accommodate that person, and that you are going to make sure that you're keeping these guidelines as you bring those patients into these ambulatory sites. Study teams should continue to schedule encounters remotely whenever possible. Again, that's the safest thing, particularly as we are still in the stay-at-home, stay-in-place executive order. New York City, it's probably going to extend a little bit longer than some of the other parts of the state. Consider performing safety visits remotely and use of external lab blood draw services for safety monitoring when possible. For example, I need to bring my patient in to get their study drug. Here's why that we think the pros outweigh the cons to do that. I'm going to comply with these guidelines to do it and keep everybody as safe as possible, but minimize the number of times you need to bring them in. It is going to be still the best way to think about this. So lots of folks are already performing safety visits remotely using different methodologies, and they're working with external services to do lab blood draws, et cetera, for the safety labs. Now, what if you want to use the clinical research unit in Annenberg in the trailer? Current policies and procedures, again, will be aligned with the guidelines for return to practice. Now, Annenberg does not have a screening site for the pre-screening visit. So we've worked out and asked if we could have them go to the 5 East 98th Street entrance to be screened. And that's where we will be directing them. And they will be getting their symptom check and then given a surgical mask, if they don't already have one, to enter into the health system. I would encourage that you think about having your research coordinators perhaps meet them to then escort them over to Annenberg if possible. It can be a little bit tricky for people to maneuver around the health system, and particularly because there are going to be other things going on in the Annenberg lobby now. We just heard they're going to be continuing to use the pods that are set up there to do the antibody screening, et cetera. The other thing I'd say about the CRU, we will continue to do phlebotomy visits, but we do not have walk-in phlebotomy visits. We changed that policy during COVID, and we're going to maintain that now. All phlebotomy visits must be scheduled. You can reach out to Joanne Zephyr here at this address if you have questions for that or other things. So we want to accommodate, but again, we're going to have to maintain social distancing, et cetera, and we can do that better if those are scheduled. This is phase one. We're going to revisit this, as Eric said, for the wet labs and others, and we're going to follow very closely New York State and New York City executive orders, experience data from the ambulatory practices, and changes in any other hospital metrics that suggest there may be a problem or not, and how we go forward from there. And that's what I have.
Very good. Roz, thank you very much. I now want to call on Gopi Patel to please give the community an update on plans for testing and related activities.
Good afternoon. I'm so happy to be here with all of you and see maybe a light ahead of us. So a couple of things. There was a broadcast email by Dr. Lopachin today that has a nice link to what New York State is discussing about the metrics for us to open more fully, and where Mount Sinai Hospital is located in all of our hospitals, and the school falls into the Mount Sinai Hospital campus, obviously, where we are in terms of meeting the metrics to open up fully, and why there's this slow ramp up to make sure that hospitals in New York City have the capacity if there is a second wave. We are close, but we are not there. We don't currently meet the 30% metric for open ICU beds and for the threshold for new hospitalizations. But it's nice comparing us to upstate versus downstate and where we are in New York City compared to the rest of the state, and maybe gives you some guidance of what the next steps will likely be based on the city versus Governor Cuomo's recommendations. Now, in terms of testing, on Monday, there was a broadcast from the system about our goal to offer appropriate testing to all employees, staff, faculty, and students. As Dr. Nestler suggested, we are planning to offer antibody testing to everyone. We are not quite sure if that's an immunity passport. We do have a lot of faith in our lab ability to identify COVID-specific antibodies, and that's due to the great work of Dr. Kramer and his lab, and those members of our pathology and clinical laboratory departments who really ramped up very quickly to meet the demand. Our intention is to perform 7,000 antibody tests a week in the Annenberg West lobby. And so that will be for you all. You will be told by your department lead when your time has come to voluntarily get antibody tested. That information will be yours and yours alone. We will probably publish information in aggregate, but not specific to you. It will not be part of your medical record per se. There'll be a firewall, so it's only part of employee health or student health record. This is for your knowledge and for your comfort. The eventual meaning of this is yet to be determined, but we hope to learn more soon. We do know New York State, as they are asking for all nursing home staff to be tested routinely, that they are accepting an antibody positive test as someone who does not need to go and be tested for viral test or get a PCR test. In the nursing homes, it will be weekly for now. In terms of viral testing, there is also the ability to be tested if you have symptoms. That will still be done through employee health. Again, part of your record, and also in terms of HIPAA compliant, your information will be confidential, but this is also to keep you, your colleagues, your family safe so that you know what your next steps are. Right now, we would ask you to self-isolate for 10 days. If you remember, weeks ago, we said 7 days. The CDC has changed its guidance to 10 days based on a single study where there was viable virus shed at about 9 days. Symptomatic improvement and 3 days of no fever and resolving symptoms that can be contained with a surgical mask, which Dr. Miller explained how you would get a surgical mask every day so that you can keep, again, yourself, your colleagues, and your family safe. In addition, we will be offering asymptomatic viral testing. It's unclear what this will mean for now. It will be every 28 days. And we'd like to pair it with antibody testing so that if you are antibody positive, we would not offer asymptomatic viral testing, and that we could track how often we are testing you. More to come in the future as we learn about the role for viral testing. And we do still need to meet the capacity of testing our community as well as our patients. So I've seen some questions in the chat, and I hope I answered some of them. All of this is voluntary. It will not be required. So if for some reason you don't feel compelled to get an antibody test, you will not be asked to do so. In terms of contact tracings, if you are symptomatic, we would like to know that information. We do plan in the next 2 weeks to start launching contact tracings again. In the healthcare worker and clinical scenario, it's unclear what the guidance is going to be from the New York State and New York City Department of Health. In the non-clinical setting, we are learning more as upstate opens up a little bit about what their recommendations are going to be. The CDC website has been updating quite frequently, and we don't really understand where it's going to land. A lot of the information is based on if you have prolonged contact with an infectious person, not fleeting contact, and not if you're socially distanced 6 or more feet away. I think that's a summary of where we are in terms of that and where we are in terms of the hospital opening up further. I think I also addressed the Annenberg West lobby and what the goal is. It would be for asymptomatic antibody testing.
Right, so quick question, Gopi, about the antibody testing. One person is asking whether they'll be charged for the antibody test.
So no, they will not. That's the other reason to have it, one, done under employee health or student health, because you're not charged for any of that assessment. It also allows us to see where we are and contribute to the community literature about, you know, is it healthcare workers? Is it administrative staff? It's very interesting for those of you who are interested. In London, they did a study looking at viral testing and noted that the administrative staff and the healthcare worker had the same rate of positivity, suggesting it was mostly community spread. And I think we really want to inform the literature. Also, the dictum from the powers that be, beyond Dr. Charney, is that we are not to charge for any COVID-related care.
Excellent. Thank you, Gopi. And about the West Lobby, just quickly, people have asked about the state of the lobby. Starbucks is open.
Starbucks
the
is
escalator
open.
is open.
Starbucks
Easy
is
access from the basement to the upper elevators for the upper floors of Annenberg.
Yeah, Starbucks is open and hopefully appropriately socially distanced. I did not visit today. Please feel free to let us know if there's something that you recognize or if you have recommendations of how to do it better. I think the hospital was relatively caffeine deprived and we need to sort of ramp that back up. The cafeteria, they are still asking that you wash your hands, you wear the mask that all of us should be wearing, and that you maintain distance in the cafeteria as well. So we're doing our best to make sure all staff, faculty, students, and employees are well fed and well caffeinated.
Thank you, Gopi. Let me turn things over to Marta Filizzola, who can give us an update from the grad school perspective.
Right. So let me start by reminding people, Erica, that this week is a big week for PhD and MD and dual degree students. They will get their graduation ceremony this Friday. So there will be the ceremony at 2 p.m. And so we would like people to attend the ceremony. And there will be also the award ceremony on Thursday at 3 p.m. So these are main events that mark milestones in the life of students. So it's important to remind them. I'd like to clarify one of the questions actually that we got about summer interns and whether or not MD, PhD students and the PhD students will be allowed to take research rotations as soon as we open. And the answer is that yes, our goal is actually to protect the careers of our students and trainees by allowing them to make the research progress whenever it's possible. So it's important that they come back to our labs and start having those experiences. We will give preference to our rotation students over the summer students. So there may be restrictions to the high school students that we usually have seen over the summer. As you know, we have canceled our summer undergrad research program, so there will not be a summer undergrad research program, and this is also to allow to have as many students back on campus, but still maintaining all the safety guidelines that have been given so far. We have had several concerns, obviously, from our students and trainees about safety, transportation, and childcare. So the only thing that I can say confidently right now is that we, in our profession, we are somehow lucky that we have flexibility in our working hours, and we will work with the PIs and with faculty to ensure that people can still keep that type of flexibility and allow them to get back to regular or more regular life in the months ahead. So there will be flexibility there, and we are also fortunate, I should say, that we are considered essential workers, and this is important, especially for our foreign nationals who were concerned about visa status during this period. And the truth is that right now there are no envisioned problems for the visa extensions and for receiving the new students, new postdocs at Mount Sinai. So we are fortunate that we are considered essential workers. So I don't know whether you want me to address some other questions.
I think that's good, Marta. One of the questions came up. What about faculty who want to bring on new postdocs who are coming from overseas? What is the current policy for hiring non-US citizen postdocs?
Recruitment is on for everyone at Mount Sinai from overseas or from the States. There might be delays in travels because of some countries might have still travel bans in place, but the recruitment should proceed as originally planned. There may be delays again, but there are no reasons to to believe that we won't be able to proceed with the hiring.
And a really critical corollary is that any of you who want to hire personnel on grants, we want you to proceed with those hires. I've had a few people come to me with some concerns and challenges. Please contact me if there's any delay in getting your personnel hired. We want you to be able to hire personnel on your grant money. Good. Okay, so let me just address a few questions. We only have about a bit over 5 minutes left, but a few questions have come up. Several people have asked on both ends of the spectrum if the COVID-19 research work has been safe, why not fully open up non-COVID research 100%? And then other people have asked at the opposite end of the spectrum, how is our 25% opening consistent with the state and Governor Cuomo's continued restrictions on New York City? Let me answer both. The ramp down on March 20th by us was voluntary. We did not have to do it because from the beginning, the state and the federal government and New York City consider all medical research to be essential. Many biotech companies in the New York metropolitan area have remained at 100% activity because of that edict. But in the abundance of caution, we did not know what to expect, so we ramped down activity. Having seen the labs now and the clinical performance occur quite safely for our staff, we are confident to allow a slight opening of our research activities slowly, steadily. We'll get back to normal, but we want to do it safely. So medical research is essential. As I mentioned, our employees in the clinic and in the labs have a lower rate of infection compared to the general population. And in phase 1, a return is voluntary.
Maybe, Eric, I can just mention
Please.
that I think it was the last issue of Nature, there was an article talking about the lack of availability of clinical trials to patients with diseases such as cancer and heart disease, mental illness, and so forth, because ambulatory clinical trials were shut down in many places, and that these patients were suffering serious medical consequences. It just highlights that medical research is essential, and while we think we made the right decision at the time, we now feel, as all of you have articulated, that it is safe, now to begin to reopen. Even now, with an abundance of caution, we're only opening at a reasonable level. But remember, we've got to get back to the work of making discoveries that change the lives of our patients, and ultimately do what Roz has highlighted, to begin to open our clinical trials.
Eric, could I answer 2 questions?
Yeah, go ahead,
see
Roz. Of
there?
course. Yes, go ahead.
Sorry, just as I'm reading through, I know we don't have a lot of time, but 2 things. People outside of Mount Sinai East have asked if they need to come all the way down to do the pre-screening visit. No, we're working on that, and we still have some conversations to have. So Mount Sinai Union Square, BI, yes, we will be using your pre-visit screening sites. We need to identify those for you and make sure that they're open to having research subjects come through as well, and as we get these in place. Second thing, people asked, why not, can I start recruiting if patients are coming to the health center for a clinical visit, and we often recruit in those clinical sites, can we start that up? That will be in phase 2. We are thinking about that, and we absolutely want to get to that, but we want to see how this goes and how our pre-screening goes as they open the ambulatory practices. We don't want to jam up that process, right? We're getting there, and we want to do this as quickly and as safely as we possibly think we can. So we are thinking about that. So I just wanted to answer those 2, and then I'll continue to look.
Excellent. Thank Roz. You know, I think we're basically out of time, but let me just address one other question because several have come up about elevators and parking and public transportation. So the elevators, people are concerned about what is the right occupancy for an elevator. We don't have system guidelines for that yet. Right now, we're asking people to use common sense. I'll tell you what I do. If I am waiting for an elevator and the door is open and it's crowded, I don't get in. I wait for the next one. I leave more time. Most meetings are by Zoom now anyway, so that becomes less of an issue. And if I'm in an elevator and I'm nice and cozy because there's only one other person in there with me and the door is open and 5 people walk in, I walk out. And I would urge people to just use caution. And we will think as a system of whether we should have system-wide guidance for elevator occupancy. Around parking and public transportation, we realize that these are challenges for people. We've been providing parking on campus for this time period when people have had to come in at all hours of the night to care for sick patients. This can't continue forever. We're going to have to go back to normal. We don't know when. Please stay tuned and we'll give you guidance along those lines. I think we should stop now. We did receive over 100 questions, and what I will do is make sure, working with my colleagues, that we'll post answers to the questions on the research roadmaps, is to look for answers to your questions, and we hope to get them posted within the next few days, certainly well before Monday. Thank you again, everyone, for joining us. We had over 1,100 participants today. We very much appreciate your interest. We are very excited about getting back to business safely and slowly. Thank you.